Good morning and welcome. Thanks for joining us for House Calls, Real Docs, Real Talk. I'm your host, Mercedes Fuller, back for another healthy conversation. Today's show is another look at health equity, but this time from the perspective of housing. It's a sad fact that zip codes often determine health outcomes, and COVID-19 certainly illustrated that for us in glaring detail. But what can we do about it? How can we ensure equal care for all? Helping me out to answer this question and so many more is Dr. Kiari Kershaw, Associate Professor of Preventive Medicine, Epidemiology at the Feinberg School of Medicine at Northwestern University. Doctor, welcome.
Thanks for having me.
Absolutely. We're so excited that you're here with us to answer all of these important questions. Let's move on. Good health is always newsworthy, so each week we select a current headline that ties back to our topic at hand. We bring it back to our table, and then we ask our expert to respond. This week's entry comes to us from NPR, and the title is Black Americans in Racist Architecture of Home Ownership. Dr. Kershaw, this article talks about the practice of redlining. Can you define that for our audience today?
Sure. Redlining refers to the longstanding practice amongst financial institutions of systematically denying people of color home loans based on a racially biased calculation of risk. So the term redlining actually dates back to the mid-1930s when the federally sponsored Homeowners Loan Corporation created color-coded maps for cities across the country that indicated risk levels for long-term real estate development. And predominantly African-American and immigrant neighborhoods were systematically deemed high risk, which corresponded to red areas on the map, hence the name.
Wow. Wow, so much good information there. And we're going to continue to examine that a little bit more. Let's get into our main segment with your live viewer questions. We call it You Ask, We Answer. Let's get right to it, Doctor. There are so many questions in the queue today. Our first question comes to us from Lewis in Oklahoma City. His question actually mentions redlining. Is redlining a contributor to the lack of housing security for Black, Latin, and Native Americans?
Absolutely. Homeownership is an important source of wealth, and redlining makes housing situations less stable for all of these groups. And I think the impact of redlining on housing security among Native Americans gets less attention than for other groups, but banks are often long distances from reservations, and that, combined with persistent unemployment and systemic racism against Native Americans, has limited their access to financial capital and credit needed to support homeownership.
Wow. Wow. So much good information. How about this one from Deborah in Burbank? She's asking us, what is the connection between a lack of housing security and heart disease?
Yeah, so having an unstable housing situation is stressful, and people who are constantly stressed and feel like they don't have control over their situation, they may adopt unhealthy coping behaviors that increase their risk of cardiovascular disease and heart disease, like smoking cigarettes or eating or sleeping poorly. And this chronic stress associated with not knowing where you're going to live or if you're going to be able to pay for your housing is also related to high levels of inflammation and other biological responses that contribute to heart disease.
Absolutely. Here's one from Kayla, and I'm also wondering this question too. What does housing have to do with exercise and wellness?
So having stable housing and not worrying about having to find shelter or paying your mortgage can give you free time and peace of mind that could allow for exercise and other wellness promoting activities. And in addition, being able to find affordable housing in neighborhoods that are safe and walkable promote exercise and general well-being.
Wow. Wow. I didn't even consider that correlation, but that is so important to know. Des from Lansing, Michigan, he's asking us, is housing a concern for just rural areas or urban areas?
Yeah, so the types of housing concerns are different in urban versus rural areas, but housing is also an important concern in rural areas. So housing costs are less in rural areas, but poverty rates are higher and more persistent, and access to mortgage credit is more limited, leaving some families struggling to pay for housing. And while homelessness is far less common in rural areas than urban areas, poor housing conditions are really a big problem. So a substantial portion of dwellings in rural areas have inadequate housing or plumbing systems, leaks or pests, which also are related to heart disease risk and general other health outcomes.
Here's one from Richard in Lawrence, Kansas. Richard is asking us, why do you think that homeless adults have 60 to 70% higher rates of cardiovascular disease events?
Yeah, so competing stressors, including the need to obtain nightly shelter, food, and clothing, make it harder for homeless adults to engage in healthy behaviors and to seek preventive care. So this can lead to earlier onset of CVD risk factors like high blood pressure or diabetes, or delayed diagnosis of these conditions, and then also poor risk factor management due to a limited ability to pay for medications or to adhere to the lifestyle changes or kind of conditions that you need to take to effectively manage your medication regimens. And all of this leads to an increased risk of cardiovascular events.
Wow. Wow, so much good information here. Bernice from Colorado Springs wonders, what is affordable housing and what does it mean to be housing insecure?
Yeah, so being housing insecure can range from having difficulty paying your rent or mortgage because it's such a high percentage of your income, to being homeless and sleeping on a friend's couch or in sheltered or unsheltered temporary housing. And so affordable housing is a situation that the cost of housing doesn't overwhelm the percentage of your income. What that ideal percentage is varies by place and household, but the Department of Housing and Urban Development uses a cutoff of 30%. So affordable housing would be somewhere where your housing costs 30% or less of your income.
Marcus in North Carolina asked us, what role does what role do foreclosures play in risk factors like high blood pressure, mental anxiety, and homelessness?
So home ownership is a major source of wealth, and suddenly losing this wealth and something that you worked so hard to get and put so much into has a lot of negative physical and emotional consequences, including stress and anxiety, which can contribute to high blood pressure, but also potentially homelessness. So it is related to all of these things, mostly from that kind of wealth shock.
Our final question today comes from Shauna. Shauna would like to know, how do residential segregation and gentrification impact risk factors of CVD?
So both segregation and gentrification are processes that limit access to affordable housing in high quality neighborhoods. And so this limited access to neighborhoods with more resources impacts cardiovascular disease in several ways, including safe streets and parks to exercise in, convenient access to healthy food options.
Dr. Kershaw, thank you so much for joining us today. I'm glad we're finally talking about the connection between neighborhoods and health. It's about time that we had this important dialogue. Let me ask a question of you. What can we as citizens and voters do about this issue? It seems to me like there's no easy fix.
You know, there's not an easy fix, but I think that we can all advocate for more policies that increase the supply of affordable housing. So things like inclusionary zoning policies that require developers to include a certain number of affordable units when a larger market rate development project is started, or rental assistance programs. And then I think also when these new developments are being built, like the affordable housing units or buildings, we need to take a more of a yes in my backyard approach instead of this not in my backyard approach, which I think happens often. So really thinking about what this means for other people in our society in general.
Absolutely. Absolutely. Thank you so much for weighing in on that. I really do appreciate you sharing your time and your knowledge with us today, Dr. Kershaw. Very useful, valuable information that we should all take and apply with us in our daily lives. That does it for our show today. You can find any of our previous shows at the HAAHA's House Calls YouTube playlist. It's been a very enlightening show today. And next week, we're going to lighten the mood a little bit. We're talking about our kiddos returning back to school. So until then, make sure you take care of yourselves and each other. And we'll see you next episode. Thank you so much.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.